Okay, so in today's presentation, I will be reviewing the Performance Year 4 CTI application process, as well as going over the new thematic area that was approved. So this should be very similar to those that have done the application process in prior years, but of course, feel free to ask questions. And of course, we also know there's always sort of new people to the team that's been added. So just as a reminder about some of the resources that are available, especially as you all consider changes and modifications for next year. So the CRISP does have a CTI learning system. This is sort of our home base for everything CTI, where prior recordings have been published, other resources. One of the things we really want to bring to your attention is 3 different resources that were published towards the end of last year. And really, essentially, these are different versions of the policy guide intended maybe for different audiences or different purposes. So essentially, as you look down this list, there are 3 different guides, starting from an overview to the most detailed. These are linked here in this PowerPoint, which we'll send out, but are also linked on the learning system at that top website or URL. So the introductory policy guide, this is just a few pages. Really, the intention here is to do a high-level overview of the key components and intention of the CTI program. It's a good sort of starting base, shall we say, for people new. The next step, or the next deeper dive, is the CTI specifications and methodology guide. This is truly very comprehensive when it comes to the methodology, the formulas that are applied, that are used in the CTI program are included here, and really hopefully deep dive on anything that you could possibly want to know. And finally, the CTI technical review was actually something that was done about a year ago and has been slightly updated since, but this is an example from the full start all the way down to the reconciliation of what a CTI looks like. So it sort of has helped modeling out what that process looks like on the back end. And the recording of that webinar, which happened, like I said, I think it was about summerish of last year, can be viewed on the learning system as well. So all of them are there for your resources, and again, I think are great as we look into the next performance year. That being said, let's dive into PY4. So just as a reminder, Performance Year 4 does run across the fiscal year. So it starts in July of this year and runs through June of 2025. We did have one new submission for a thematic area, which we'll go into detail in just a few minutes. So in addition to that new one, there are now 6 thematic areas, the 5 prior thematic areas: primary care, palliative care, care coordination, emergency care, and community-based care, of course, are still available. A reminder about this application period. So it did open this past Monday. Those who have access can already go in and use the system, and it does close on Friday, May 31st. So it's important to have those dates because essentially those are the only dates in which hospitals can add, deactivate, or change their existing CTIs for PY4. So that being said, if you have CTIs that you're very happy with, you want to move forward within the current definition, there actually is no requirement for you to do anything. By default, every single active PY3 CTI will roll over to PY4 in the existing definition. And we sort of want to underline and emphasize existing definition, because if you need to tweak an NPI list, if you need to update a DRG, or add a zip code, all of that actually technically are modifications, and that needs to be done by creating a new CTI. So any small change is essentially creating a new CTI, disenrolling an old CTI. But if there's been no changes, it's a fairly broad standard CTI, please, those can go forward, and there's nothing new that needs to be done for our individual participants. On the flip side, the deactivation side. So deactivation is really the only thing that cannot be done within a CTP. So we do need an email directly from our hospital participants to the HSCRC to let us know that they are deactivating a CTI for PY4. We ask that you include your unique CTI number, that makes sure we're all on the same page and there's nothing that's missed. And just a note, deactivation, what does that mean? So it doesn't mean that your current CTI stops today or the day that you email us. All of the existing PY3 CTIs will remain active through the reconciliation period of PY3, essentially this time next year. However, it won't restart on July 1st. So you'll still be able to see that CTI in the CTP for last year, but again, it just won't continue forward for the next year. And we do request that you email us at that hscrc.care-transformation@maryland.gov. We will send you a confirmation email about that as well. A little bit about timing there. Okay, so the application process, again, this is not unique. This has worked actually really well for the last couple of years, but everything is being done through the Care Transformation Profiler. As a note, not everyone who has access to the Care Transformation Profiler has access to add, edit, modify CTIs. There's actually a separate role called a submitter role, and each hospital can designate up to 3 users in that submitter role, and those individuals are the ones that have that specific tab or navigation button available for them. If you don't know who they are, if you want to change them, please email us. We'll get that all squared away. We know there's turnover each year and things like that. So please reach out to us. But right now, every hospital does have at least 1 up to 3 users who can do that. In the CTP, which we'll demonstrate in just a few minutes, hospitals are able to get some sort of very high-level baseline information about their definitions, so they can see number of beneficiaries and total payments that are available, and that can be utilized to help people tweak or confirm the intention of that CTI definition and what was inputted in the system. Additionally, because you have that baseline volume available to you, hospitals are also able to assess their expected minimum savings rate across all their CTIs. Important considerations as you guys look at your episodes and look at potential modifications, we want to bring up 3 different items. So the first is we're happy that we've actually introduced 2 additional baselines that are available. So calendar year 2022 and fiscal year 2023 are now available for baselines. It may make sense based off of a specific program or maybe changes within a care pathway to use a newer baseline. So we're glad that those are now available. Also want to note this was announced in the TCOC subcommittee a month ago, 2 months ago, whenever that was, but starting next year, new CTIs will actually be required to use these newer baseline periods. But this is the last year that brand new CTIs can select between those old historical baseline years that are available and these newer ones that have just gone live this year. So please keep that in mind. The other 2 have to do with certain versions of data sets that we're using when it's applied to the CTI. So as we just mentioned, we have these great new baselines, and with those new baselines, we are using the chronic condition flag, the version 30 of the chronic condition flag for the CY22 and FY23 baselines. If you are using a different baseline, we are still using the version 27. So again, keep that in mind. Overall, probably doesn't have a ton of differences, but again, some differences as we look at how definitions sort of are applied and changed. And the other one is your APR DRGs. So all CTIs for this fiscal year are on the version 39 of the APR DRG list. It is important, and we really ask hospitals to go in and ensure that that CTI list, that code list is, that APR DRG list is correct. We do not update them ourselves. Chris cannot, manage and do the crosswalk between different versions. So it is important, if you do know there's a significant change, please update it. Overall, it is our impression that version 38, the last version, and version 39 are fairly similar. So it overall likely shouldn't matter much, but we think it's really good for participants to get into the habit of that being sort of part of their yearly evaluation within their CTI definitions. Because again, as versions update year over year, that change could have more significant of an impact. So I'm going to pause there. The next part we're going to do is moving into the new thematic area that's available, but want to pause if there's any questions at a high level of what the CTI application process looks like for this year. Okay, I'm not seeing any hands, so I can move on. So very exciting. Actually, it's the first time since we first started the CTI program, we have rolled out and approved a new thematic area. It is the Hospital Outpatient Services thematic area. You'll see it abbreviated HOPD because that is certainly a mouthful. And again, this was something that was shared at the TCC and sort of has been happening in the background with a lot of collaboration with some of our hospital partners. So we do appreciate that. So a little bit about that. The hospital outpatient CTI is our 6th thematic area. And just like with our other thematic areas, the creation of this is all going to be done through the CTP and will follow the same sort of standard application process. Just as a note, really the impetus for this and the intention when the hospitals brought this to us is to look at specific interventions that are being utilized to manage the direct care of outpatient services. Some specifics about certain surgeries or certain therapies were some of the examples that were brought up. Again, an example in a more surgical world could be looking at post-operative, reducing post-operative care complications, reducing length of stay, and that recovery time, all things that could be things at play as far as interventions that hospitals have in place. The one difference is we ask that if you are looking at this thematic area, just give us a heads up so we can work together. We really just want to pay in some extra attention for like the validation and the intention of what you all input as the criteria is truly being selected. Again, this is our first year for that. So just some extra attention and care. We will know when you press submit, but obviously if you have the heads up earlier, we can just work together and again, make sure that what you're intending to create by this new thematic area is actually what's inputted into the system. So let's talk about the actual CTI itself. So just as a reminder, all these thematic areas sort of revolve around this trigger event. And essentially it's a singular or combination of factors that are used to identify when a beneficiary is actually enrolled in that CTI or in that intervention. Just with all of our other thematic areas, it's 100% claims driven. So it's nothing that is in your EHR or your clinical data set. It has to be identified via claims. So for the hospital outpatient services CTI, the event or the CTI is triggered by a hospital outpatient claim, which contains specific or specified CPT or HCPCS code that is attributed to a specified NPI. So what does that mean again? We require that it's an outpatient claim, and then we look at 2 required input fields, a CPT or HCPCS code that you all put in, and an NPI. You need at least one for each of those. Of course, you can put multiple in for each of them, but at least one for each of those. The combination of those 3 matching up will open that intervention or open that CTI. I'm going to circle back to that note in just a second under there because it is important. A couple other things, as we have with all CTIs, there is some customization available for individual hospitals. So there is some criteria. I will note one is not customizable this year, and that is baseline. So because this is a new thematic area, there is the requirement for all CTIs to use fiscal year 23. That's the July 2022 through June 2023 as their baseline. In future years, as more baseline years become available, that will be something that can be customizable by the hospitals. But for this year, it's the only one that's available. In the other areas, these are not new to this thematic area. We're carrying over a lot of the customization from other thematic areas, but you have things like age, geographic service area, chronic conditions, prior utilization, and episode length that can be all customized to the intervention for that hospital. By default, essentially, there are going to be no restrictions put in place. So for example, if you don't specify a zip code, every zip code will be included. Same with chronic conditions and prior utilization. The one exception is episode length. We obviously need an episode length. So by default, it will be 90 days, again, unless a hospital does select something different. So now let me circle back to this little note under here. In part of this conversation and working closely with hospitals, one of the things that got brought up was the overlap between EQIP and this CTI, or potentially how a hospital creates a definition in this thematic area. Certainly surgeries is something that could fit very well in this thematic area. So one big thing is that no NPI that is currently enrolled in EQIP will be eligible to be included as an attributed NPI in this thematic area. So we don't want things to be 100% overlapped or double dipping in that case, but there are really good opportunities for sort of similar interventions, but maybe it makes sense to use a CTI since these are hospital-based, or perhaps it's a brand new service that does not have the availability or eligibility volume for EQIP. This may make sense for the CTI. Again, you can work with us directly if there's sort of questions about that or things like that. We're happy to do that, but as part of our validation process, when the application period ends, we will be verifying that, again, there's no duplication of NPIs between this thematic area and the other or EQIP program. Okay, I will pause here because that's actually sort of all the summary when it comes to the hospital outpatient CTI. So if there are any questions about that, please let me know, and we can also answer them at the end. Okay, great, I'm not seeing anything. So let's go straight into the CTP demonstration. Give me 1 second. Okay, hopefully you all can see my screen, and it is the CRS reporting suite. So hopefully this is not new for everyone, but when you go into CRS, you'll be under the Medicare tab, and then you will look for care transformation initiatives. It does look like I have some questions. I will circle back to one question in one moment. So essentially what you're looking for when it comes to this application process is this participation management tab up at top. Again, only those users that are that have that role as a submitter will be the ones that have access to that tab. Reach out to us if there's questions about that. But essentially what you have here is really the starting point or launching point for all new CTI creations. You notice it obviously defaults to PY4 at this point, since the submission period is open for that. So really, we're going to focus on these enrollment actions on the right here. I'll talk about what each one of them does, and then we can dive into how they're actually utilized. So the create new CTI is pretty straightforward. This is really where you would start if you want a brand new CTI. Think about it as a blank template. You go in and we'll click one of those. You can drop down and select your thematic area, and then there'll be a cascading of next steps based off of the criteria that you select. Once you have CTIs that are created, you will be able to go back and edit them. So that's where this edit active CTI submissions is in here. You can see I did like a test one earlier. So that's where this lives. If there isn't one created, it's not going to show up there. So, if you first see, oh my gosh, it's not there. Well, that makes sense. There isn't. It hasn't been created yet. So don't be alarmed if that's that appears blank. The same thing is sort of for the view CTI submissions. Once you click that submit button, you can go back and edit, but this is essentially where it lives if you would like to go back and view them. Nothing has been submitted. This button is working as intended, but there's nothing there because, again, nothing's been submitted. So if you see this here, don't think, oh my gosh, I'm missing something. Again, once you submit CTIs, once you click that view submitted CTIs button, it will be viewable here. And the next is the create CTI from existing definition. So the main difference between this top create new CTI and this bottom create from existing definition is essentially it's going to pull in a definition that exists in its current form. A really good example of this could be you are looking to strictly update an NPI list. So you may go in and select your old CTI. Again, I'm just going to select a random one here. And when you press this button, it will bring you to that template that's been pre-populated with the definition of that other CTI. And you could easily jump right in and go to the NPI list, and edit your MPI list to update it. Alternatively, you're looking to keep everything the same, but you want to update that baseline period. This is another prime great example. Go in, copy everything over, and then you can change that, that baseline period. So it'll give you a little bit of a shortcut or quick step to go in and do. So with that said, I'm going to jump in and actually, just create one together. So I'm going to create one completely blank. So we're going to create this new CTI. Again, this default is everything's empty. The first thing you're going to want to do is select the thematic area. So you can see we now have all the thematic areas here. As you select them, and I'll click this here, you can see some of the trigger criteria and the editable or customizable sections will change. So if I'm selecting, emergency department, you see that the trigger criteria just changed versus, hospital outpatient department, as we just talked about. There's different definitions for the triggering event, which again can be specified a little bit later. The other thing that may help is there are some questions essentially about what is the intention of this thematic area, or how was it built? There is some information up at the top right part, which again can kind of help you all go in and decide what may make the most sense for the intervention that you're looking to highlight here. So I'm going to do a care transitions because it's always easy here to start with that one and sort of most encompassing. You are going to put in your CTI name. We do ask for a mix of, somewhat descriptive, but obviously there is some limitations with the total character length here. So I'm just going to do a test, heart failure 1. You do need in every step to click this save button. You can see if I do next, nothing is created. It's going to give me an error. But as soon as I click save, it's going to create the CTI, and we know this because an actual new unique identifier is put in place here. Many of our CTIs allow individuals to select if they want to include the index event. What that means is typically the hospitalization is, are we including that entire inpatient stay from when that event first happened? You can choose to exclude it, and essentially your CTI will start day 0 discharge, or the day after the event, or if you include it, again, it's going to have that entire stay or index stay that's included in the cost there. A lot of times there's opportunity within that index stay, so that's why people select to include it. Alternatively, if the interventions are only looking at potentially post-discharge or things like that, perhaps that could be a reason why someone does not include the index stay as that. So for this purposes, I am going to include it. Again, everything at the right here is going to default to, you can customize it, but if you would like to say, hey, I want to skip all these steps, I know I don't want to do, let's say, anything with prior utilization, I can do my default. And essentially what you put in these steps as we do our next button will cascade to the available tabs in the next part of the workflow. So for the time being, I'm just going to say, let's customize everything. Even if you select custom, again, you can still select the default. There's nothing wrong with that, but it at least will give you that option to sort of walk through each one of those steps. So again, for the time being, selecting custom for everything. So I'm going to save this, and I'm going to press next. So in many of our CTIs, as we talked about, you do have the option to select your baseline period. As we just mentioned, the new baseline of FY23 is available. So if I select that start, obviously my default end is also going to go in. And then you also need to go in and select what hospital is this for. As you know, CTIs can be done at the individual hospital, or if you are a system or a network and are choosing to include multiple hospitals, you can go in and select, many people. And just for the safety purposes, I'm just going to randomly select a hospital. So BWC it is for this one. And again, all these you can go back and change. And the other requirement here is a CTI description. I will say we get a lot of questions about what has people done that is working well. We don't have a requirement, as far as semi-annual submissions or things like that. So we really like to emphasize that the CTI description can be super helpful when we looked at shared learning or best practices. So we really ask that you put in here the intention of the CTI, describe some of the interventions. Again, utilize this in a way that it truly can be beneficial as we look at doing analysis down the years. And again, trying to look at what our best practices are. I'm going to do the opposite for the time being and just put test. So don't do that. So please include a couple sentences here. The other thing is this hierarchy. As we talked in years before, there is a hierarchy, a default hierarchy associated with the CTIs. You can go in and actually select that. That may be something you choose to do or go back and do at the end when you know all of your CTIs. This does not need to be filled out. By default, we will use the hierarchy that's in the system. But if you know, this is the CTI or intervention you've invested in a ton, you want every single beneficiary that can be eligible for the CTI to be eligible, you can go in and say, I want this to be my top CTI, their number one hierarchy. Conversely, if it's a relatively new CTI, maybe it's something that has a little bit of overlap with another area and you want your emphasis to be in a different one, you can go in and go all the way to 10. Even if you don't have 10 CTIs, you could have 3, but I want this one to be the last one and this one to be the first. So it is important if you have those preferences going into that you can select that. Again, maybe it's something that makes more sense to do after all of the CTIs have been created and you're able to kind of get a sense of where there may be overlaps or like maybe where your resources have been allocated internally. So for the time being, I'm just going to leave it blank and I'm going to press save and next. What your next button is going to do is essentially is going to walk through every single one of these steps. If on your first page you decided to say use default, you may not see some of these fields. So if I said use default for geography, I will not see this field here. If I decide to go back and actually want to put zip codes into it, I would need to go back to this main function or this main landing page and select I want to use custom to get that, that step in the workflow to appear. So again, I did this page, I'm going to select next. And with all of these, we're not going to jump into all of them because they look very similar, but essentially each of these tabs are either a templated Excel file that's required to update or some checkboxes, drop-down boxes that a user can go in and select based off of their criteria. So I'm going to look at zip code. We're going to do one of these together. But essentially, you want to make sure that you are using the download submission template or the template that was intended for each one of these. When you do this, you are going to get a download. And again, you can use that template. It will be blank. I pre-populated some. Hopefully, you guys can see my full screen. And this is essentially what the zip code will look like. This will first appear blank, and you can go in and add the zip codes that you want. You can be 1, you can be 10, go in and add. As you add additional lines, you can, again, it'll just add to the table as is submitted, or as that is shown. So I'm going to show you that I just completed this template, and then what you would do is you would upload your NPI, your zip code list, sorry, and you would choose where to find it. So I'm going to find it in downloads, and I will use this zip code template. Let's open it. And it will give you a confirmation that your file has been uploaded successfully. We find that files that are not uploaded or you get an error, it almost always has to do with sort of the formatting or configuration. Think about it, if you put in the wrong number of characters, let's say in an MPI, it's going to come up an error or things like that. But that's the primary place to go in and look at it if you are getting an error. Once you upload this list, it will live here, and you have the option to do a couple different things. If you go back and then say, oh, I just completely messed up that list, I did the whole wrong area, you can do that exact same exercise, but overwrite this list. So any new Excel file that you upload would essentially completely wipe out this zip code list and rewrite it. Alternatively, if you just, let's say, wanted to add 4 more onto it, you still upload that, that template, but you use this append. So if we added it, you would then see it added to the end of this list. Now, the third option that you have is, oh, I just made one small error. I just want to go in and change something. So let's say I want to just change this one zip code. You can double click on it. And again, you have the option to go right in and change it to whatever you had intended it to be. You can save it. Or I didn't even need to put that zip code in at all. You can use your little trash can function and delete it. Really easy, again, if you're just looking to make some small edits. However, if you're using a much larger list, the overwrite and append functions are probably easier and more efficient for you all, so you do that. So we are going to do next. And again, it's going to bring you to the next section of this. This is your DRG list. And again, it's a very similar functionality. So you can download your submission template and you will have the availability to then upload it. For the time being, I'm going to skip this one. But essentially, DRGs, ICD-10s all work the same way. You have a downloaded template and you upload it. Again, we want to emphasize, please pay attention to those code lists, especially based off of the version that we're using. Some of the other ones, so we'll look at chronic condition and prior utilization, are pre-templated in, meaning you need to go in and actually add something. So the chronic conditions, again, it's using the CCW to indicate this. You can choose to either include or exclude based off of your chronic condition. And what that means is very commonly we see, let's exclude cancers. So you can go in and select certain ones and let's see if I got all of them. I think I did, but for the time being, and say, actually, I'm selecting these chronic conditions and I'm going to exclude that. So beneficiaries with that CCW flag will not be included in there. Now, the other way that you can utilize the chronic conditions is to hone in on a specific population. So I would like to do heart failure here. Where am I seeing it? There we go, heart failure, and I'm choosing to include it. Now, if I also wanted to say, I want to do heart failure, let's say, and hypertension, I could say my threshold for this is 2, or sorry, if I have no threshold, it's going to require both of them to be done. If I say, well, I want them to have either one of them, you want to update your threshold to reflect the minimum number of the chronic conditions that you selected to be included. So in this case, when I do a threshold of 1, since I have heart failure and hypertension selected, it's going to tell me that my beneficiary has to have at least one of those chronic conditions to be included. Again, I could select more of them and still say I only want 1, or bump my threshold up to 2. And what this means is now, out of the 3 chronic conditions that I have checked, 2 of them, your beneficiaries have to have 2 of them in order to be included in your CTI. So I'm going to minimize that, and I'm going to save this and move to my next one. So prior utilization, this is looking at both inpatient and ED utilization prior to the CTI or prior to the event. The intention here is to really hone in on beneficiaries that have used multiple services. You want to really have resources that are dedicated to maybe connecting them with outpatient services or things like that. So for prior utilization, you're going to go in and select essentially what was that type of utilization. So it can be an admission or observations. Really, you can kind of select from any of these. And you're going to say, well, what is that utilization threshold that I'm actually looking at? So I would like the beneficiaries in this heart failure to have at least 1 admission in the last 6 months. That's essentially what the window and the threshold means. Again, you can change that as you get more specific. Your eligibility will likely decrease. So keep that in mind when you're looking at the total population that you're trying to isolate here. And then the other thing that you can look at is the hospitalizations in specific settings. Again, you can choose if you want to, let's say, exclude anyone from a SNF. And again, you need to specify the window. So in the last 6 months. Vice versa, you can say, I only want to look at those patients that are coming from SNF locations, and again, move that to include based off a certain time frame. So all of that is very customizable. I'm going to save this. I'm going to do next. Look forward. Period is essentially looking at the first setting after the event, after the index event. So by default, we are including every type of setting. However, again, you may want to say, I want to exclude those beneficiaries that first post-trigger setting was in a SNF. So I'm going to go in and select the exclude dropdown. Again, that's maybe you're honing in on a specific population. A lot of times we see maybe everything but community in excluded. So again, you're really focusing on just the population that, again, based off of their claims data, that first post-trigger setting of care is in the community or is the home. So you want to, again, decide what you'd like to include or exclude for the time period. I'm just going to include everything for here. I'm going to save this and press next. And here is also episode length, which again is customizable. By default, many of these thematic areas are going to have, I think, mostly 90 days. Obviously, our panel ones are the full year. So if you do have the option to customize this, you can go in and, again, select how many days or what is your window that you would like for your CTI. Let's save this and press next. Now, the model estimate, this is probably the biggest thing that we get questions about. This is essentially where you get that information of what did my definition or input criteria spit out. When you generate this episode estimate, when it is completed, you are going to see the total beneficiaries in the baseline and the total payments in the baseline period as well. Please note that this could take take a couple of minutes, it could take a couple hours. It really depends on how many of these models are being generated on the back end. I would say if it's over a day, if it's 24 hours later and you're still not seeing anything, let us know. But primarily things are done within a couple hours, but it's a good place to go in and see essentially what happens based off of my input criteria. Many people also utilize this function to create, let's go back and change the baseline, and then they'll rerun the model and we can kind of compare what are some changes to the definition and what are the downstream impacts of it. The other thing to pay attention here is because it gives you that output of baseline volume, you will be able to get a sense of what the MSR is for your hospital. Again, there's two different MSRs based off of the panel-based or setting-specific CTIs. I'm not going to run it here, but you can kind of see. And then finally, when you feel comfortable with everything, you're going to actually submit this CTI. We will get a notification that is submitted. It will move to that view submitted CTI field in that homepage area. And again, that does not mean you can go back. That does not mean you cannot go back in and edit it. But it's essentially us saying, okay, we can now go in and do some validation for that CTI, ask some questions if need be, but it essentially says, okay, I'm done. So I think that's it. And then the other option that you have to do is once you feel comfortable with it, if you would like a record for your own, you can export a PDF version of your definition. So I'm going to save and continue this later. Now what you will see, because I've created that CTI, is it is going to be in this drop-down list. So I can now go say, oh, I totally forgot, an NPI in this list. I'm going to go to my test heart failure, drop down, click edit CTI submission. And all of those functions that you just had are now available. You can go back in and walk through every single step in that. I can't do NPI here. That was a bad example. But you can go back in and edit something and say, oh, I forgot a zip code or something like that. Go in and change that. Okay. Did a zip code here? Oh, I did. Okay, good. Just didn't show up for a second. So I think that is essentially the functionality here. Just as a reminder, some of those steps will look a little bit different, or some of them may not be available based off of the thematic area that you have selected, because each one has just slightly different customization options for you. So I think I will pause there. I am seeing some questions. I'll take the chat first, and then of course, feel free to let us know if there is any additional questions. So the first one is about the baseline period, different from other CTIs. So just as a reminder, all thematic areas now have the fiscal year 23 or calendar 22 available for your baseline period. However, CTIs in our new thematic area, that hospital outpatient services, are required to use FY 23 as the baseline. That is not something that they can go in and customize. Is the overlap of beneficiaries between a care transitions and hospital outpatient thematic areas permitted? So our CTI overlap policy has a hierarchy based off of thematic area for intra-hospital overlaps. So, and I apologize, I don't know, or I honestly don't know if we've decided where the hospital outpatient falls within the hierarchy, but essentially different thematic areas are ranked. And then within that same thematic area, the prioritization or the hierarchy goes to the smaller CTI. So if you have two CTIs in a care transition, one which has 100 beneficiaries and the other that has 300 beneficiaries in their baseline, that one with a smaller number is going to be by default ranked higher than the larger one. Again, we can get back to you about what specifics for that hospital outpatient one is and where that falls within the thematic areas. We can certainly send that out. And just as a note, again, all of that is customizable. If you do not want to use the default, there is that functionality in that first, I think it's basic CTI information page that allows you to go in and designate the CTI. There is a question about MD-PCP CTI. It feels like the setup for that would be different. So one of the things we did look at, I'm happy to sort of jump in, is we do have sort of panel-based CTIs. So if we look at the primary care panel-based CTI, this looks at NPI attribution over a year. And you can kind of see, you can isolate that attribution based off of specific conditions or utilizations. There is some customization there to perhaps match similarities within an MD-PCP population, but it certainly does not need to default to that. Again, a lot of people are using it to maybe isolate a specific population, maybe one with higher utilization or more chronic conditions that are getting the bulk of the services that a primary care office may offer. Does generating the baseline estimate take a hierarchy into account? No, the baseline will not, that model estimate does not take hierarchy into account. It's simply looking at your straight definition, what the output of that is. We certainly will do some validation on the back end. And if we do find that, essentially one CTI entirely engulfs another CTI, we can work with you in that together, but it's not part, fortunately the system's not too set up to do quite all of those different variables. Next question was about updating the provider NPI if NPIs were listed on a CTI. So there's no requirement to update your NPI list if you're happy with that NPI list, or if it's a facility NPI or something that isn't changing, it certainly can carry over and there's no necessity for a participant to go in and change it. However, if it's a certain set of practitioners and there have been some changes or turnover, that would be an instance that you likely would go in and update that NPI list. But it, of course, is not a requirement. I think that is through all of the questions that I'm seeing in the chat. If there is anything else, please let me know. Oh, there was one additional question about the version 38 APR DRG list. So this is just a little bit of a reiteration of what we talked about earlier, but this new CTI year, we will be using the updated version 39 of the APR DRG list. Looking at it, there's a lot of similarities. This may have zero impact on your CTI. A lot of the DRGs, may carry through, but we do ask just some extra attention. You work with, your internal coder team to say, is there anything significant in the different versions that may carry through to your input criteria that you put in for that CTI definition? Again, maybe unlikely, but want to bring it to your attention. I think as we update further and further versions, it could have a more significant impact on it. And again, the update would need to occur during this application period or enrollment period. Okay, I am not seeing any additional questions, so we can pause here. If we will send out a recording of this and the slides, everything will be posted on the learning system, but we'll send it out to the team here. And yeah, please feel free to reach out to me directly or that HSCRC inbox if there are any questions. And yeah, that's it. So thank you all. We appreciate your time today.